Hi, my name is Connie, and I'm a social worker with Alberta Health Services. Welcome to this video about transitioning from pediatric to adult healthcare for youth who will need decision-making support as adults. Healthcare transition is when your child's medical care will move from the child-centered pediatric setting to an adult healthcare setting. This includes preparing for the move itself, and adjusting to the new healthcare setting. Like other life changes, the transition from pediatric to adult healthcare can be both exciting and stressful. It can help to start planning for your child's healthcare transition ahead of time. Youth and families share that the earlier you start preparing for the transition to adult care and services, the smoother the process will be. And this has also been confirmed by research. The actual move to adult healthcare is a one-time event that happens around 18 years of age. But transition happens over a longer period of time. You may choose to begin the transition process as early as 12 to 13 years of age. However, some tasks will need to be completed when your child turns 16. It helps to know what to expect during healthcare transition because there are many differences between pediatric and adult care. In this video, you will learn what you can expect during healthcare transition and how to prepare. Adult care is not a one-stop shop. Your child's healthcare team may include specialists at several locations. It'll be very important for your child to have a family doctor or a nurse practitioner who can help you coordinate care and navigate the adult healthcare system. There may be different eligibility criteria to see a specialist in an adult clinic. Family doctors or nurse practitioners may need to monitor your child's specific health concerns and make referrals to new specialists when needed. Appointments with your adult specialty clinics will focus on concerns related to the clinic area of expertise. If you have questions that aren't related to the specialty clinic, they may suggest that you talk to your child's family doctor or nurse practitioner. Adult clinics may not have the same supports provided by some pediatric clinics. Therefore, it might become more difficult to access care provided by occupational therapists, physiotherapists, social workers, psychologists, or other type of therapists. If your child requires these services, ask the healthcare team about how to access them. Good communication with your child's new healthcare team is very important. For example, you may need to clarify who is responsible for booking follow-up appointments. Will the clinic contact you with an appointment time for your child, or is it your responsibility? Ensure that you and your child understand what the adult clinic expects from patients. If your child misses an appointment, adult clinics may not call to reschedule like some pediatric clinics do. Some may even discharge your child from their clinic and require a new referral for your child to see them again. You can ask questions about how the new clinic works at your first appointment. Wait times in an adult clinics and emergency departments are often longer than for pediatrics, and appointments may be shorter and less frequent. If you feel like there isn't enough time with the healthcare provider or that you aren't getting your questions answered, going to appointments prepared with a list of questions can be very helpful. As a parent or caregiver, you have likely been responsible for making appointments, filling prescriptions, and talking to your child healthcare team for many years. In Alberta, when your child turns 18 years of age, they legally become an adult and are considered to have the capacity to make their own decisions. Therefore, the adult healthcare system expects patients to manage their own medical condition, make medical decisions, and advocate for themselves. If your child has a developmental disability and will continue to need your support making personal and financial decisions, you'll need to apply to the courts to be their legal decision maker. Personal decisions include healthcare, legal proceedings, where your child will live, who your child can associate with, and what they'll do during the day. The two personal decision-making options in Alberta for those who require support are co-decision making and guardianship. The only option in Alberta for financial decision-making is trusteeship. It can take several months and sometimes up to a year to receive the guardianship and trusteeship order. When your child turns 17 years of age, you can start this application process. When your child turns 18 years of age, they'll no longer be eligible for funding from programs that support children. You'll need to give yourself time to learn about options for adult funding and when you need to apply for these programs. Each program requires different supporting documentation, like past school or medical reports or government-issued photo identification. It's important to understand what each program requires. Gathering these documents early will help ensure your child has supports in place when they turn 18 years of age. Some examples of adult supports include caregivers for respite, independent living, and community access. Persons with developmental disabilities, or PDD, is a program in Alberta that provides funding to help adults with developmental disabilities live as independently as they can. It can take more than a year to process the application and get day programs and caregivers in place. Apply for this program when your child turns 16 years of age. There is also a program in Alberta that provides a monthly living allowance and health benefits for adults who have a medical condition that impacts their ability to earn a living. To ensure your child begins receiving these benefits at the beginning of the month after they turn 18 years of age, apply when your child is 17 years and 6 months. For example, if your child turns 18 years of age in May, they can start receiving the benefits on June 1st. In this example, you would apply in November. In addition to applying for adult decision-making supports and funding, there are other things you can do to prepare for these changes. Help your child reach their highest level of independence. Involve them in conversations about their future and listen to their hopes and goals. Support them to take on as much responsibility as they can in managing their medications and treatment plan. Encourage them to talk to their healthcare providers and answer questions when they're able to. Teach them about their medical condition and provide them with paper or electronic resources so they can access their health information. Find a family doctor or nurse practitioner your child likes and one who they can continue to see as an adult. This is important because they're the coordinators of your child's care. Family doctors and nurse practitioners make referrals to specialists when needed, receive results from medical tests, and are generally the most consistent members of your child's healthcare team. If your child has complex medical needs, it may take time to find a family physician or nurse practitioner and build their understanding of your child's condition and treatment plan. You can start this process as early as 12 years of age. This gives time to build a trusting relationship with them and ensure that they have the information needed to provide ongoing care. Feelings of sadness over losing relationships with your child's pediatric healthcare team are common. So is the fear of the unknown. Give yourself time to feel comfortable and establish a trusting relationship with your child's new healthcare team. And remember, you're not alone. Professional and peer mentor support is available. Talk to your healthcare team if you need help, or if you want to talk to another parent who's gone through this transition. Thank you for watching this video on transition from pediatric to adult healthcare for youth who will need decision-making support.
Find information, support, and services for you and your child by clicking on the link in the description.